Hi there, this is Anna DeLobo, and I'm going to be doing a short and sweet video today regarding back pain. And the reason why I'm wearing my blue light blocking technology glasses is because I'm going to be referring to my computer while I'm doing this video. So I believe this is my 118th video for my practice. My name is Anna DeLobo. I've been a licensed acupuncturist since 1999, and elementsinharmonyacupuncture.com is my website. If you go on my website, you're going to see that my testimonials are divided in 3 sections. One of the section is on testimonials : pain. It's specifically on pain. I'm still rebranding from my other 2 websites, but quite a few information is there. I'm not going to break down each of those videos because it would take too long, and I'm actually at work and I just want to make this a short video just to recap with some of my existing back pain cases, and for anyone who wants to come in for back pain for in the treatment of acupuncture. The reason why I'm sharing this is because many people go on my website and they say, oh, okay, she knows how to treat back pain. But I did a video called the accountability video. It explains what to expect if you go on under once a week, or 2 more times a week. For easy cases, the beginning phase is those first 10 treatments. And for chronic cases, the beginning phase is those first 20 treatments. So I'm just going to read here a few of my the back issues and kind of just break it down a little bit. Back, anxiety, and more. So there are people who come in for back pain and they have other issues going on. The reason why I put this one first, because that's the first one you'll also see if you go to pain and then you go down to back. A lot of people with back pain also come with emotional health issues. I know about back pain because I used to have a little bit, and my father had surgery for sciatic pain, severe sciatic pain in 1991. It was, pretty severe for him to need surgery. I saw a man growing up suffering from back pain, and now almost all I do, besides helping women get pregnant all day long, is treating back pain. Number one thing that I treat for men is back pain. I put down back, anxiety, and more. What I want to share is that when I and other licensed acupuncturists are treating, we definitely can treat 1 or more things, 2 or more things at the same time. What I like to do, what I want to share in this video, is that when your back pain, let's say you come in for back pain, but you've got a multitude of other health issues. When you have back pain and other issues, I like to really, I'll treat everything, but I will focus on one thing, in this case, the back pain, for at least until you're at least 50, 80, 90+% improved. When that back pain starts, you start feeling moderately significant to significant plus improvement. I define significant as 80+%. When you're 80+, at least 50, then I can be more aggressive with other things. Say, for example, the anxiety. So let's say you come in for 5 issues. You have back pain, anxiety, digestive issues, neck pain, and neuropathy. And you want me to take care of all these things. And other acupuncturists, and I know because this is my 22nd year in practice, so I've done different ways. I have done different modalities, different methodologies in using acupuncture to help people graduate from pain and suffering. I have found in my own practice that when I can be very focused on one main thing until you're 50, 80, 90+% improved, then I can be aggressive with the next thing. And then I can be aggressive with the next thing as each health issue starts to improve. Now, if you give me 5 things and I give 20% to the back, 20% to the neck, 20% to the neuropathy, 20% to the anxiety, 20% to, whatever digestive issues, you're not going to get 20% improvement right away. I share in the accountability video that the beginning phase of chronic issues is the first 20 treatments. It's important to really understand this. I share this in a ton of my other videos. Again, I believe this is my 118th video. Acupuncture is natural medicine. Typically in my practice, if you're on 3 or more medications, I'm not going to prescribe herbs. I'm not a pharmacist. I'm not a doctor of pharmacy. So I don't personally know how the herbs, the Chinese herbs are going to interact with the medications. Now, sometimes, very rarely, do I make exceptions, but I don't remember the last time I did. So when I'm helping people with back pain and a multitude of other health issues, I like to focus. So that is the first thing that I do like to share. It's very common for people to have back pain and mental health issues at the same time. That's something that I've noticed since 1999. If you go to elementsinharmonyacupuncture.com and you go to the pain section, you'll also notice that there are other back issues. What I also want to share is back and foot. I have treated many people with back and foot issues, restless leg syndrome issues. That's very, very common. Maybe, everything's related down here. So sciatic pain, there's a testimonial there for sciatic pain. I also did a video on sciatica. That one of my most difficult cases I remember was this woman. She came in. I'll let you watch the video. I believe that was in 2010. I've treated many types of sciatic pain cases, but this particular woman, her pain was so intense that she had to come 10 times in 14 days. I got her 90% improved, and then the rest of the 10% she took care of in the next 4 weeks. So I took care of it in 6 weeks, and the first 2 weeks she got aggressive. She came in 10 times in 14 days. That was probably one of my most difficult cases that I've ever treated, specifically for sciatic pain. And her chiropractor wasn't able to adjust her. He didn't want to touch her because she was so tight, and the doctor said, well, you're just gonna have to kind of live with it for a few months until it relaxes. I'll let you watch that video. It's probably still one of my favorite cases because I was able to see how acupuncture, especially balanced method acupuncture, can be very, very effective for that type of pain. One thing to understand with the style that I do is none of the needles go to the area of pain. So I'm treating quite a few people right at this moment. And when I'm treating, say, for example, jaw pain, none of the needles go to the jaw. When I'm treating wrist pain, none of the needles go to the wrist. When I'm treating back pain, sciatic pain, sacroiliac pain, herniated disc pain, elbow pain, none of the needles go to that area. I explain this over and over in my videos, but I want to share that here. So when you see that I'm not having you take off your clothes and I'm treating your coccyx pain, you're probably like, wait a minute, why is she not going to have me undress? Because I don't need you to undress. One of the things also is back and knee pain. Lots of people coming in for knee pain these days. A lot of people are working from home, and even today I'm going to take my 16-year-old daughter out and we're going to buy her a new chair. Yesterday she said, I think I want a gaming chair. And then she told me today, you know what, my friend said I need an ergonomic chair. She's been, like many kids, it is January 27, 2021, and it is COVID. And she's been at home since March of last year, 2020. So we have to, it makes sense. Yeah, you know what, she is not ergonomically correct at her desk. It looks like it, but like her setup seems fine, but it's her chair. I just put together this chair last year, and because I also was starting to feel things. So if you're working from home, which probably 90% of you who are watching this are working from home, you got to pay attention to how your setup is. I promise you, your setup is not the same as your setup in your office. And so if my 16-year-old who's in school all day is telling me after, going almost 10, 11, 12 months now on being at home, at school, from 8 to 3 o'clock, and she's having some issues with her back and her neck, then probably the majority of you are also. Your setup with your feet have to be on the ground. So when patients come in, I really break it down. I'm not an ergonomic specialist, but I do know, because that's a profession in and of itself, I do know simple things like if your elbow is here, like this desk is a little too high, but I'm barely at my office, barely at my desk. I share people with how I want your mouse. I don't want your mouse like this. This is going to cause some pain. You got to get up. You can't be in front of your desk all the time. People are working a lot more when you're working from home. So you traded in driving the commute to being in front of your desk all the time and being sedentary. I've been a big proponent throughout this entire COVID, and then during this entire pandemic, for people to go outside. You need to go run, you need to exercise, you need to stretch. I did a stretching forearms video. I did that video when I was pregnant, from your neck down to your waist. I did that stretching, showing how to stretch your forearms. So I'm going on a tangent, but make sure that you're ergonomically correct. I'm treating a lot of back and knee issues, these days. Back and scoliosis, you'll see that as one of the testimonials. In the last 22 years, yes, I've treated a lot of scoliosis cases. Herniated disc, this was probably one of my favorite cases too. This was a woman in her 60s, and this is a woman who had fled. She was a slave during the Khmer Rouge, and she picked rice every day for, I want to say, 4 years, and it's a wonder that she didn't die. Long story short, she still has residual lower back pain due to herniated disc. I even asked her, are you sure you don't want to do surgery? Because 3 surgeons wanted to do surgery. This woman traveled from Australia for, they lived in Australia and they have a business here. And during those, I want to say 4 months that she was with me, my realistic job in my mind was to get her 80 to 95% improved. And sure enough, when she left, she was 95% improved. And she didn't have to wake up every day and have to move around. She was able to get up and just go. Please do watch that herniated disc video. That is probably one of my favorite back pain cases, because I was able to see the power of balance method acupuncture, the power of what acupuncture can do for herniated disc. Did I get it to 100%? No. Was she able to walk? Yes, she was able to walk. She came in here barely able to walk. They made that appointment on the plane on the way from Australia. She had received 5 treatments in Australia, 5 days in a row, traditional Chinese medicine style, where they put the needles in the back. And then she did my style, and she was so happy to get the results. I got her where I wanted her, where I thought realistically could happen. Again, I thought she should have probably really considered surgery, but she and her husband were adamant against surgery. So I thought to myself, worst case scenario, I'm going to prepare her for surgery and she can heal quickly. But when you're 95% better and you're feeling the power of balance method acupuncture, you start rethinking yourself the need for surgery. That was her. That's not every herniated disc case. That was her. Polyneuropathy. I threw this in here because oftentimes people who have neuropathy, polyneuropathy, it's stemming from the spine. So you can check that out there. I don't want to go through all these cases, but if you have numbness, paralysis, remember the beginning phase is those first 20 treatments. So you got to be patient. You got to know what to expect if you go under once a week, or 2 more times a week. You got to understand the beginning phase is the first 20 treatments. And I talked about the sciatica. So go visit my website, elementsinharmonyacupuncture.com. You'll see videos and you'll see 3 different sections. You'll see the pain section. Please do visit that website. I'm constantly updating the website because I'm still rebranding for my other 2 websites. So there's still a lot of testimonials from my other websites. I'm very grateful to everyone who's given me the opportunity to serve them and dazzle them since 1999. I have so many files, so many cases that I want to put on video. And this one, I just thought, you know what? I'm just going to do a little bit of a mini comprehensive video on back pain. If you can point to the pain, I can treat it. You just have to understand that healing takes time. So on that note, I do want to remind everyone that I teach Qigong once or twice a month. There will be no Qigong on Sundays in February. So this Sunday, January 31, I will be teaching for an hour at the beach. It's going to be fun. Everyone's going to be far apart. You can wear your mask. You don't have to wear a mask. It's up to you. That's, you know, your life, but we're going to be really far apart, right in front of the ocean, right in front of the ocean. It's so much fun. If you are a fertility patient, please be there. If you want to strengthen your immune system, please be there. If you want to relax, please be there. If you want to feel happier, please be there. We're going to increase our lung capacity. So enough of that. If you need to text me, please do so at 619-341-4341. You can call my office landline at 949-305-1703. You can schedule directly online at Elements in Harmony Acupuncture.com. I appreciate all of you for being here. Thank you for watching this video and have a great day. All right, take care.